Hello, everybody. Welcome back. This week, I'm Alexandria Williams. I'm the prevention specialist at the Willow Domestic Violence Center, if this is your first time kind of joining us. And today we're going to be talking about kind of estimating the impact of COVID-19 on domestic violence. So before we begin, if you have any questions, please feel free to email me at awilliams@willowdvcenter.org. And let's go ahead and jump into it. So the NCADV, which is the National Coalition Against Domestic Violence, had put out some information kind of about domestic violence during COVID-19 and what it's going to be looking like maybe even after COVID-19 has finished. And so we're going to be kind of just going over a little bit of that information today. We're also going to be talking about about the power and control wheel that we've talked about before, but in relation specifically to domestic violence, or not domestic violence, excuse me, to COVID-19, now that they have some more information about what abuse is looking like in the home from kind of the first wave of COVID-19. So they are predicting that domestic violence is expected to rise 20% during the second wave of COVID-19. So they're expecting a higher amount of cases to occur than when COVID-19 initially started back in like mid-March. So they're saying kind of like the main stressors for abusers currently are employment, especially if they have been employed for the past 3 months. Also, if the abuser has not received a stimulus check, as many people have not yet during this time, or might not be receiving anything, this could also add to the amount of stress that is occurring within the home, as well as if the abuser has lost some family members or some friends to COVID-19. This could heighten some anger about the virus, as well as them kind of showing that anger towards their partner or to their children. It also increases the amount of stress that's going on within the home. So this heightened amount of anger and stress is higher than the kind of initial COVID-19 response to the stay-at-home orders and quarantine and everything, because we already know like that stress level was high. We talked about that kind of in the beginning about how that was seeming to be the cause of a lot of the calls that were coming in, a lot of the reports that were being made about domestic violence. So they're saying that on top of all of these stressors are going to contribute kind of to that 20% increase during the second wave. So the NCADV kind of went more in an economic way when they were talking about what the impact is going to be post COVID-19. So they started off kind of just talking about what the overall economic impact of domestic violence is. So as we know, there's about 5 million domestic violence cases per year. And the total cost of all of those cases ranges around $460 billion. And this is from medical costs, court costs, any type of other personal cost to the victim or survivor, but also the cost that taxpayers are paying yearly due to these types of crimes. So the average cost per aggravated assault and battery is about $87,000 per survivor or victim. And again, that's personal cost as well as taxpayer cost. So looking at the 2018 annual report from Douglas County, I found that there were 654 domestic battery crimes that were committed during that year. And again, we have to remember that not all of these would have been reported. A lot of survivors don't report, so we can go ahead and kind of assume that the amount of these cases were higher, but these were the ones that were reported. So if we kind of do that math, that 654 cases by the $87,000, it comes to around $57 million that was spent due to domestic violence during that one year. So they also go into talking about social costs versus social benefits. So social cost is basically what money domestic violence survivors and programs are taking out of the community. So kind of like another way to word it would be, what do survivors need to support themselves, and what are donors and taxpayers paying to kind of run these programs. So the four main aspects of social costs for domestic violence that they talk about are emergency shelter, of course, counseling services that occur due to domestic violence, the market rate labor, which basically is just pay for advocates, but it also includes, they also included volunteers and the time that they commit also to these programs and to the shelter. And lastly, they talk about welfare benefits. So what survivors kind of need to be able to stay free from their abusers, which could be cash assistance, food stamps, etc. So these are the things that that survivors need to support themselves, and what donors and taxpayers are paying to be able to run those programs. And so next they go into social benefits. So talking about all the positive outcomes that a domestic violence shelter and the programs that they provide, what the positive outcomes are on survivors. And they also make a point to talk about like how these positive outcomes make a big improvement on the entire local community, not just the survivors. So the four main aspects of the social benefits of these programs of running an emergency shelter are that immediate injuries are averted. They found that about 95% of survivors that came into emergency shelters could actually be protected from assault. So a lot of the costs from domestic violence are medical costs. So if we're able to avert any injuries from occurring just by providing shelter or just by providing programs and services, that is a huge social benefit, as well as not just immediate injuries, but also long-term injuries and long-term medical bills as well. They also talk about the social benefit of economic stability. So basically, when survivors come to receive services, advocates are working with them to kind of help build a financial foundation with them, so that way they will be able to have their own financial independence, which we've talked about before. And by doing this, it's benefiting their local community, because an individual being more economically stable can contribute more to their community as a whole. So they see that definitely as a social benefit. And then mental health counseling. So the more survivors that come to receive services or come to receive shelter, they're more likely to go ahead and try to receive some mental health counseling if they're having any problems in that area. And as we know, having mental health services, providing those, does have a great positive impact and benefit for the community as a whole when we're able to be mentally healthy. So this is important because they talk about, the NCADV talks about the Chanley study, which is basically, they went and they researched in this area called Collier County, and they kind of looked at the social cost versus the social benefits to see if investing into a domestic violence shelter or a domestic violence center kind of was worth it in the end. And they found that it is. They found that for every $1 that was invested in Collier County's domestic violence shelter and their organization, um, actually saved the taxpayer an average of $4.40. So their budget, their DV shelter and center budget was $5 million. So after they did the math, they found that by investing that $5 million into that organization, that it actually saved the taxpayers $52 million as a whole. So, and we know that we do this work not because of the economic benefits of it, but for some people to be able to convince them to invest, whether it's money or their time, into this cause, into the shelter, into the organization, that sometimes they need to see, like, what is it really making an impact. And this is a really good way to be able to show, like, it is. It's saving the taxpayers money, it's saving the survivors money, and keeping them safe. And so this was a really good study to kind of review and look back on if you're wanting to kind of talk to someone about, like, hey, like, maybe you should get involved with this cause. Maybe you should get involved with your local domestic violence center and kind of donate your time or donate money, whichever one you can do during this period of time. And so overall, they kind of wrapped it around in a way of talking about it, like, basically the increase of domestic violence cases that is going to occur is going to have an economic impact. It's going to cost even more money. And so they're saying that during this time, if we can combat it with investing, if we can really work hard at getting survivors in a safe space, getting them the services that they need, that the overall impact after COVID-19 is done won't be as negative as they're kind of viewing it's going to be now. So by knowing this information, whether you can share awareness on your social media, whether you can just have conversations with people that you know, whether you can donate money or volunteer or anything like that, it will impact the way that domestic violence is going to overall impact your local community. And again, if you have any questions about any of this, please feel free to email me. I know we kind of just went over a lot, but please feel free. I would love to have a conversation about it if you need to. So next, we're going to go into the power and control wheel in relation to COVID-19. So we're going to go through the different pieces of this wheel again, but we're not going to be going over the original version of it. If you do want to look at that, we did do a video of DV 101 a couple months ago. It's still on the Facebook page, and I think it's on our YouTube page too. So please feel free to look at the original one, but this one is more based on specific tactics that are being used, that were being used during kind of the first wave of COVID-19 that are probably going to continue being used during the second wave. So let's start with intimidation. So abusers might be forcing the survivor to excessively wash their hands. They might be screaming and yelling at the survivor about COVID-19. They might be demeaning the social distancing efforts. So if the survivor is doing really well at, staying the 6 feet away and wearing their mask and doing things like that, the abuser might be making them feel stupid about doing those things, about wanting to try to stay safe. They might be bringing weapons into the home, like we talked about in the beginning about the COVID-19 impact. The gun sales skyrocketed when the stay-at-home orders were put into place, and so a lot of these homes that are having domestic violence situations going on, a gun might have been introduced into that home since then, and they might be using this as a way to intimidate the survivor, either maybe to stay home, to stay with them, just a number of things to keep in mind. They might be lying about their test results. So they might have tested positive, and they might be lying to the survivor and not allowing them the chance to be able to keep themselves safe for whatever reason. And they might be contaminating items purposely to get the survivor sick as well if they are sick. Looking at emotional abuse, the abuser might be faking symptoms as a way to maybe get the survivor to take care of them, or getting the survivor to feel bad about leaving because they're sick during this time. And it could be a number of things. They might be preying on the fear of contagion that the survivor might be having. They might be interfering with efforts to care for or support loved ones, which this can also go with isolation. But if a survivor's mom is sick with COVID-19, the abuser might not be allowing them to go and take care of their loved one as a way to control them. The abuser might be refusing to share soap, sanitizers, or cleansers with the survivor, as well as endangering family, um, as well as endangering their family by purposely exposing them to COVID-19, um, which we would hope no one would do, but this could also be another tactic to be able to gain control over not just the survivor, but any kids that might be in the home as well. So isolation, the abuser might be disabling internet or phone services. And as you know, a lot of us were quarantined at home. So not being able to have internet or not being able to have a phone completely cuts you off to the rest of the world, cuts you off to knowing what's going on. And that could be exactly what the abuser is wanting. They might also be regulating internet or phone access, restricting visitors or deliveries, canceling appointments. This could be medical appointments, could be mental health appointments, anything like that. Prohibiting the survivor to run any errands. And they could be saying that it's because they just don't want them to bring anything back or whatever, but it could be just because they are wanting to keep them isolated at home since they might have been isolated for the past couple months. They might hide the survivor's keys, and they might limit the amount of space the survivor has, like for um, their own time and things that they want to do at home, to kind of be able to not really give them any type of independence within their own home as well. So minimizing, denying, and blaming. So the abuser might be just completely denying that the pandemic is even happening. Um, they might be justifying control as a necessity. And this could look like them saying, well, I want to keep you safe during this time. Like, you have to trust me. You need to listen to me. You need to do as I say, and you'll be okay. So saying things like that to try to convince the survivor that that the amount of control is okay due to COVID-19. Um, the abuser might also blame the victim or survivor for exposing family, even if it wasn't them who got the family sick, but as a way to make the survivor feel bad, also as a way to maybe keep them within the household as well. The abuser might use COVID-19 as an excuse for abuse, which kind of goes back to, or no, that ties into blaming the abuse on stress. So they might be saying, that goes back to the stressors we just talked about too, of like, well, I lost this family member, so that's why I'm treating you this way, or I haven't been employed for a month. I haven't got a stimulus check, so this is why I'm acting this way. But it's important to understand that a lot of people are also facing those stressors, and they aren't abusing their partners, and they're not abusing their children in their home. And they also might just overall be making light of COVID-19 concerns that the survivor might have. And that's part of kind of like that minimizing, and making the survivor feel invalidated about how they're feeling about during this time. The abuser might also be using children. So they might be purposefully exposing children for the sake of, simply for the fact that they know that this is going to affect the survivor. It's going to make the survivor feel negatively. And so they might do it for that reason. They might also insist on sheltering the kids. So custody orders might be kind of disheveled during this time, and the abuser might use that as a chance to get the kids back. So maybe they might say something like, well, my house is more equipped to have the kids be here long term during this time. It's safer for them to stay here, all this stuff, but really they might just be wanting the kids back because they know that that's another way that they will be able to have control over the survivor. And then now that things are opening back up and people are going back out, they might be declining to return the children to the survivor after the survivor might have agreed to have the kids go ahead and stay there. They might be failing to take precautions at home. Also, if there's a custody agreement where the abuser gets maybe some Zoom time or FaceTime or whatever with the kids, the abuser might use that as an opportunity to kind of be calling whenever, and kind of disrupting and intruding on the lives of the survivor and their children. Next, we're going to look at economic abuse. So the abuser might be interfering with the survivor's efforts to regain financial independence. So if they're trying to get a job now that things are opening back up, they might be doing whatever they can to kind of make that not happen, especially if the survivor hasn't been working and they've been staying home and relying solely on the abuser during this time. The abuser might also be refusing to allow the survivor to work outside the home, and they might say that this is because, well, I just don't want you to catch anything and bring it back. But in this case, it would be because they don't want the survivor to be able to have any type of life outside of the home, as well as any type of financial independence outside of them, the abuser. The abuser might also be excessively spending during COVID-19. So if the survivor is the sole breadwinner in the house and they're the only ones that have a job and they're making money, the abuser might be taking that money and just spending it on whatever, and not allowing them to have enough money to even get their basic necessities because they might have been excessively spending. Abusers might also deny support while the survivor is laid off, so maybe not even helping them with their basic necessities like toiletries, food, anything like that, as a way of punishment, or another power and control tactic. They might also be threatening to evict the survivor if they see some behavior that they don't like. So saying something like, well, if you make me mad again, like, I'm going to kick you out. And knowing that the survivor might be unemployed during this time, might have no one to go to due to the isolation tactic that might have been used. And so the abuser knows that is enough to kind of scare the survivor into acting the way that they want them to act and staying with them during this time. So male privilege, so the abuser might be taking up all the work and study space in the home. They might be demanding absolute quiet during work hours, which can cause a survivor a lot of anxiety, especially if it's an 8-hour workday, having to tiptoe and be quiet, but then purposely doing that as another way of getting that power and control. They might be refusing to share the computer within the home, and this could have an impact on the survivor's job, also on an aspect of them being able to connect with any form of the outside world during COVID-19. The abuser might be deciding who comes and goes. They might be demanding attention, even if the survivor is having to work, anything like that. They might be disrupting the routine of the survivor or their kids. And lastly, they might be keeping food or supplies to themselves and not sharing them with the survivor or the kids that they share. And lastly, we're going to talk about coercion and threats. So the abuser might be threatening to expose the survivor's loved ones. So if the abuser is sick, they might be using that as a way to get the survivor to stay. So saying, well, if you leave, then, I know where so-and-so lives and I'll go, and, things like that to kind of scare the survivor into staying. They might be faking a fever. again, to get the survivor to kind of take care of them, arousing fear that they're all going to die of COVID-19. So um, playing into that fear that a lot of us probably have during this time. Um, Another thing that was interesting that they talked about was also that abusers might be forcing the survivor to expose other people to COVID-19 if the survivor has it. So that is definitely something to be aware of. They might be engaging in risky behavior, going into maybe public spaces where they know people might have it, and then coming home. They might be coughing in the survivor's face as a way of threatening them, withholding care, or focusing obsessively on COVID-19 during this time. So a lot of us might want to be a lot of us might want to find a way to be able to support our friends and family during this time if they are going through this. And so these are some of the warning signs. Their partner might be putting them down in front of other people. So you might not be able to see this in person, but I know some of us have weekly Zoom sessions, maybe with our friends or family. So if you're seeing this during those sessions or FaceTime sessions, whatever, if they're constantly worried about making their partner angry, so if they feel like they're walking kind of on eggshells all the time around their partner, if they're making excuses for their partner's behavior, their partner is extremely jealous or possessive, and we all know jealousy is a human emotion. We all feel it, but it makes a difference about how you react to that emotion. If their partner or if they have unexplained marks or injuries that you see maybe on a Zoom call or you see while they're out running an errand at the store, if they've stopped spending time with friends and family. So if you're having those weekly Zoom meetings and they just stop showing up or they keep making excuses that they can't, um, oh, sorry, that they can't tune in that week. Also, if you're noticing that they are depressed or anxious, um, or any kind of notices of change in their personality is important to look out for. And so lastly, just being able to support different ways you can support them during this time if you are noticing those warning signs. Acknowledging that they are in a difficult and scary situation and that they really need you to be supportive and to be able to listen to them during this time and to not be judgmental. Um, we know it's hard sometimes to not just want to ask, well, why don't you just leave? Why don't you just end the relationship and do this and that? But it's important to understand that it takes a lot for a survivor to talk to anyone about what's going on. There's a lot of shame accompanied with that relationship at times. And so if they're coming to you and they're opening up to you, we just really encourage you to just listen and be there and be present with them in that moment. If they end the relationship, do continue to support them. The struggle does not end once they are out of the once they're out of the relationship. There are going to be a number of struggles, and we know that survivors often tend to go back to their abuser. So if you can just support them during that time and keep on encouraging them and helping them with what they need while they're making that transition of leaving, they have a better chance of continuing to stay out of that relationship. Also encouraging them to participate in activities outside of the relationship with friends and family. This is a good way to combat that isolation tactic by kind of reminding them that they have a life outside of their relationship and that there are people that love them outside of outside of their abuser. Excuse me. Help them develop a safety plan. And if you don't know how to do that, that's perfectly okay. Have them go ahead and call their local domestic violence hotline, and there will be an advocate on the other end of that line that will be equipped with the knowledge to be able to do that. Also encourage them to talk to people who can provide help and guidance. This could be an advocate at the domestic violence center. This could be their therapist. This could be a spiritual mentor. Just encourage them to talk to somebody about it and not to just keep it to themselves if there is violence that is occurring within the home. And lastly, just remembering that you cannot rescue them. um, you have to meet the survivor where they're at in their experience. And so support for them might not look like you saving them and you getting them out of the relationship. It might just look like you helping deliver groceries to them, you texting them every so often, checking up on them, you helping them come up with a safety plan, things like that. Um, but don't try to force your wants on them, because it's all up to them if they're going to leave, when they're going to leave, how they're going to leave. So we can really do is just let them know that we're there for them no matter their decision, and that we want to keep them safe no matter what decision they're making during that time. So this is our hotline number, 785-843-3333, and this is also our website. And there's more information about COVID-19 stuff on there, as well as if you're interested in getting services, anything like that, please feel free to call the hotline or check out our website. Um, Again, please feel free to email me if you have any questions. And thank you so much for joining me today.